Well, Space Coast Dale is here with Dr. Mike Ronsisvalle. We're here at the Florida Counseling Centers down in Melbourne. Mike, thank you for inviting us out here today.
Thanks for coming out. I appreciate it.
Mike, this is an incredible center you have here. Tell us about your personal background and something about you and how you've put this project together.
Absolutely. Several years ago, I really felt a passion to help people that were struggling with depression, anxiety, addictions, and so I followed through with some schooling. I've got a doctorate in clinical psychology from Wheaton College. I'm a licensed psychologist, and about 10 years ago, moved back to Brevard County, my home. Grew up here, one of the few natives, and my goal was to help this community, to be a force of good in this community where people could really find a safe haven to go from where they're at to where they want to be, and that is the Florida Counseling Centers.
Well, Mike, tell us about your center approach here and the other really brilliant people that are working with you here at the center.
Absolutely. I'm proud of the team that we've put together here at Florida Counseling. Essentially, we've got psychologists, licensed mental health counselors, licensed marriage and family therapists, as well as a medical doctor. Together, that team can handle pretty much any mental health issue that comes through the door. We have two main parts to our practice. Number one, we have an addictions rehab. So rather than people going away for 30 days or 28 days to South Florida or California to get help for treatment if you're struggling with addictions to drugs and alcohol, you can stay home, sleep at your house, keep your job, stay in school, and come to our program between 10 and 20 hours a week. That addictions program is run by licensed professionals who are all sort of working together to get you clean and sober, but also keep you sober. There's a 90% relapse rate for people that go away to rehab. We're trying to change things here in Brevard and give people hope that they can do it differently. We also have a mental health side to our practice, and we've done this very differently. What we found is sitting one-on-one with a counselor once a week can be really effective, but man, it just does not capture the complexity of what goes on for people as they struggle with depression, anxiety, trauma, ADHD, OCD, anxiety disorders, personality disorders. So what we've done is we've assembled a multidisciplinary holistic team. So not only can you meet with a counselor, you meet with a treatment plan team that is going to help you build a treatment plan specific to what's going on for you, body, mind, and spirit. So we have a massage therapist that's amazing. We have a medical doctor that can look at your medications and even give you a test to see whether or not the medications you're on are the right medications for what's going on in your brain and your body. We have a nutritionist that can look at your diet and help you understand what is contributing to mental health issues or lack of energy or weight problems. We also have a phenomenal yoga instructor that can help you learn how to relax your body. And the list is endless. I'm so proud of the team that we've put together here because it yields results. What we're doing here, I can't tell you some of the stories, all the stories about how good people are getting by spending a little bit of time and effort to take care of their body, mind, and spirit.
So what type of people, do you help here? I mean, from all walks of life, young and old?
We can take a 4-year-old that is acting out at home and throwing temper tantrums. We can deal with a 10-year-old ADHD kid who is struggling to pass class or do well in school. We can take that angry adolescent that's driving you crazy at your house, and we can work in family therapy, individual therapy, and help you understand as parents what to do to deal with that oppositional behavior. We deal with 20-year-old people, the 30-year-old, 50-year-old. We actually have someone who specializes in older adults. So people that are kind of in the last half of life and who are looking at, kind of how to make peace with where they're at. I'm proud of our team because we can address pretty much any issue that walks through our door.
So Dr. Mike, thinking about a typical person, a 19-year-old who's having some substance abuse issues, once the parents and the person have made a decision to come get your help, what can they expect to happen and sort of how long would that treatment last?
So everyone that walks through our door meets with an assessment coordinator who basically takes all the information in, and they understand what kind of treatment is going to best suit that person's particular needs. We don't have any cookie cutter programs here. That treatment plan is then presented to the patient or their family, and they buy in. We are not going to do anything that you don't buy into. Typically, like if a 19-year-old person struggling with addictions is going to be here probably a month, maybe 2 months in our intensive outpatient program, and then maybe a little bit longer in once a week therapy for 2 or 3 months.
And what sort of message would you have for parents out there? They want to get their teenager in, but the teenager is no, I'm not going to go see that. I'm not going to go do that. That's not something I want to do. How do you overcome that?
I would say, number one, hang on, buckle your seatbelt, because it's not always easy to deal with an adolescent, right? But the important piece is to speak in terms of like rationality. As emotional as your teenager gets, go back to reason, go back to presenting them with choices. Life is about choices. Either you're going to get better or you're going to get worse. You're not going to stay static. So give them choices, and then ultimately look at the power that you do have to encourage them to follow through.
Okay. And, for a parent thinking about cost,
Right.
how is this handled?
So it depends on how we plan your treatment here at the center. All of our treatment is essentially based on what the felt need of the client is. So sometimes a group will be $40 for the whole group. Sometimes individual therapy will be $100 depending on which counselor you meet with. The programs are a little bit more expensive, but you're getting a tremendous amount of services. So our rehab is $3,600 per month, unless you have insurance that will help you cover some of that. Our integrative health program for someone with trauma or depression, anxiety, probably is $1,500, $2,000 a month, and you're getting, I don't know, maybe 40 to 60 hours of services that month. So it comes down to probably $50 an hour, essentially, for most of our services.
Sure. And the insurance that you actually work with?
So we are on the Health First panel. So anyone with Health First insurance, we're in network for those people. Other people that have out-of-network coverage, we accept payment at the time of service, and then we give you a receipt that you turn into your insurance company, and they reimburse you directly.
Well, Mike, what is the success rate of something like this, and what can people generally expect to achieve?
Well, that's a great question, because there's some bad press about psychotherapy in general, right? The idea of, does this even work? What we found at our center is we can provide an experience for you that will be different than most every other counseling experience you get, not only in Brevard County, but really anywhere. We're on the cutting edge of what's changing in our field. So our success rates are pretty good. I've got to be honest. We had a lady in our integrative health program last month who essentially wasn't leaving her house. Just wasn't, she was done with life. And it took us about 4 weeks, but through good therapy, meeting with a medical doctor, yoga, massage, a lot of our classes that she attended, this lady took a vacation last week. So we're finding that if you're willing to work and you're willing to put in the effort, you can get better.
Mm-hmm. Now, what message do you have for people out there who sort of almost lost hope, like that lady you were just mentioning?
Yeah.
What would be your message to them?
My message is there is hope. There's hope for people. We live in a world that is just honestly broken. It's broken in some ways that it scares me to look and read the news and to look at the internet. And I understand why people get to a point to where they just don't feel like there's a way out, and they don't feel like they can change, and they don't feel like anything could ever be different. But the truth is that the message that you send yourself about the hope that's possible is everything. The battleground is your mind. The more you convince yourself there's more hope, or there's no hope, the more hopeless you get. So the first step is recognizing you have control of your life. You can make changes that will allow you to live the life that you've always wanted. The first step is just making that first call. It's reaching out to someone in community to say, hey, I need help. And we want to be those people in Brevard County. We want to be those people that can be on the other end of the line, walking you through that process and helping people find hope and healing and joy and all the things that they want to live in.
Great, Mike. It's been a pleasure, and we're going to be doing a series of interviews with the rest of your team, and so the public can really learn about everything you offer. And
Right.
we're very excited about bringing that news to people, and I'm sure you're going to help an incredible amount of people. If they want to find you, call you today and get more information, where can they go?
So you can go to our website, floridacounselingcenters.com, find a tremendous amount of information about us, our practice, and our team, or you can just give us a call, 321-259-1662.
Mike, thanks. Have a great day, and really appreciate what you're doing for Brevard.
My pleasure. Thanks for having me.